are four main categories of the physical thing. Number one is settlement. Number two is history. Number three is general appearance. Then it's vital signs, and then head-to-toe exam. For signalment, you need to complete the description of the animal species, breed, age, sex, reproductive status, and characteristics. History, you examine the environment, diet, medical history, reproductive history, vaccination status, and current medications, description and history of complaint, and any reported concerns. Now we move on to the general appearance. For general appearance, observe from a distance up and up close. Look at the ribs for body condition. Meditation, you check its consciousness and attentiveness. That is for meditation. Posture and gait, watch them walk. Hydration, skin tucker or consider different breeds, or the breeds. For vital signs, you check the body weight. If it's under 20 pounds, then it should be on a small animal scale. You check the temperature. That's taken rectally through the butt. Heart and pulse rate, you check from femoral artery. Respiratory rate, you perform that visually or asculation. Perfusion, mucous membrane color, capillary roof of head. Head-to-toe exam, which is kind of the mouth, like head to neck. Compare both sides of the head for symmetry. Assess the eyes for discharge. Nose and symmetry and any discharge from the nose. Oral cavity. Lips, teeth, tongue. Ears, if it's clean. And palpate lymph nodes. And check the trachea and see if there's any swelling. Trunk and limbs. Inspect the bodies for symmetry. Palpate each limb and joint. Evaluate muscle mass and tone. Examine the skin and hair coat. Alopecia, masses, dryness, and parasites. Palpate pelvic region. Palpate vertebrae column. Palpate peripheral lymph nodes. Thorax. Palpate the thorax. Cardiac auscultation in multiple locations. Start at 5 intercroral space. Evaluate heart rate and rhythm. Count for 15 seconds and then multiply by 4. Respiratory. Check for any noisy breathing at the mouth. Auscultate at least 4 areas of the chest. Right, left ventricle, and left dorsal. Respiratory rate. Visually or auscultate. Count breaths per minute. Check the degree of chest movement. Abdomen. Inspect for symmetry. Auscultate abdomen for intestinal activity. Palpate abdomen. Start at the spine and move ventrally. Cranial, stomach, liver, spleen, pancreas, small intestine. Middle, spleen, kidney, small intestine. Caudal, urinary bladder, prostate, uterus, colon, and small intestine. External genitalia. Verify the sex, reproductive status. Don't assume the client's right. Inspect for hair, feces, and masses. Inspect for symmetry and palpate mammary glands, especially if it's female, like the supply. There are 3 main types of restraints: psychological, physical, and chemical. Psychological is the least restrictive. You use soothing voices and gentle petting. If animal is trained, you can use commands. There are incentives such as treats. Chemical, you use sedatives or tranquilizers. It should be on painful patients. Veterinary administered only. Lastly, there's physical. It's a primary method of restraint. You can evolve manually restraining or equipment and tools. Minimal is best. Utilize technique, not strength. It is necessary when an animal is at risk of reacting out of stress, injury, or benefits of it include reduces likelihood of injury, more accurate, and reduces stress of animal. When that does not work, when verbal and psychological does not work, use a leash or a halter. Restraint of dogs is hugging, reclining, or like lateral, kneeling, sternal, sitting, standing. Stretch restraint for cats, restraint bag, and kitty burrito. The immune response. Homeostasis is the maintenance of a constant internal environment inside the body. Blood and lymph nodes combine with the immune system to protect the body from pathogens in order to maintain homeostasis. It has multiple layers of defense to protect the body from pathogens and to maintain homeostasis. There are types of immunity. Acquired specific is developed after an animal has developed or contracted a disease. Genetic, inherited ability to resist disease. Active, white blood cell memory from having the disease or a vaccine. Passive, animal receives antibodies through milk, blood, or whatever. Transfer is temporary. There are multiple lines of defense, which is pathogens are bad. They're like viruses. The first line of the defense is chemical, reflexes, or mechanical. The second line of defense would be stuff as fever, and then third line, some mutated, and then it's life. I don't know what that really means. I don't know if that's good. For number one, the process is pathogen would be introduced. There's going to be the first line of defense, non-specific skin, mucus, membranes, normal microbiota. Second line of defense, selective non-specific something inflammation, pyrexia, and then the third line of defense, specific antigen antibody response. Specific immunity, primary response. When an animal is exposed to an antigen, it takes 3 to 14 days for the antibody to be produced. Secondary response, the quicker, larger production of antibodies due to memory cell activity prevents the animal from developing the disease a second time. Non-specific immunity is general responses of the body, which is not specific to a pathogen. Then it branches to selective, which is inflammation, protective proteins, and NK cells. Immunity, ability to prevent or stop infection from a pathogen. Continual, which is the skin, hair, physical coughing and sneezing. Specific immunity is antibody/antigen response to a particular pathogen. Required specific immunity is immunity that is acquired after birth. Genetic is present at birth due to inheritance. And then active acquired immunity occurs after having the disease or a vaccination. Passive acquired occurs when a blood transfusion is taken. Types of a disease, there's categories. Non-infectious, which result from injury, improper nutrition, genetic abnormality, and bad environment conditions like heat or cold, or exposure to toxic materials. The second type of disease, other than non-infectious, is infectious, which is a disease caused by microorganisms that gain entrance into the body in numbers. Examples of non-infectious would be vitamin deficiency, obesity, poisoning, and cancer. Infectious would be rabies and ringworm. All infectious diseases are caused by a pathogen. A pathogen is a disease agent caught, and most commonly refers to infectious organisms such as bacteria or fungi. Infectious diseases are contagious if they're transmitted past animal to animal. Contaminated feed and water could be a possible reason for transmission. Vectors could spread disease. A vector is an organism that introduces the pathogen that causes the disease. Natural selection has provided livestock and animals to reduce transmission of disease. Skin, hair, and feathers provide the first line of defense. The disease triangle is is when a host becomes infected. So that's number one. Number two is a pathogen to cause infection. Number three is an environment conducive to the transmission of the pathogen in the host's body. Okay, that's all I think I have. I'm not sure. Okay. So sanitation is really important because it reduces the impact it has on the environment. Sorry, I'm tired. The first step of sanitation is through cleaning or removing organic waste. Antiseptics, those are something that has several properties like high degree of germinal potency, works broadly on many kinds of microbes, has a low surface tension so it spreads easily, long lasting potency and has rapid sustained action. It's not harmful or toxic to the tissue of animals. Germicide refers to an agent or substance that destroys a microbe. Disinfectants are products that reduce spread of microbes. A sanitizer is a kind of disinfectant, by the way. For dead animals, waste and refuse should be removed so it doesn't spread. Carcasses should be buried within 6 feet of soil. Mud holes should be filled. And I think that's all now. So.